Usually what will end up happening is patients will ask whether we sell bands or equipment, and we do. So what you need to do is check the pricing sheet when they ask. That way you can know what to sell and how much it costs. Then you need to make sure to inform the front desk so that they get charged for it appropriately. Now, we don't want to just hand out bands and equipment just because it costs us to get them. That's why we sell them. But if your patients have any questions, you can refer to that sheet and then also talk to your therapist.
This is tubing for shoulders, and then this is any T-band type exercise that they need for ankles or lower extremities. We sell our equipment by the foot, so we have a pricing sheet with each item on it. And so once you cut it, let the front desk know, and they will charge them the correct amount for their equipment.
All right, so the most common supplies that we sell to our patients are these tubing bands as well as the T-bands. And so one of the things that we need to do is cut it and tie it for the patient and give it to them, and then they can pay for it. So when cutting it, we'll get a measuring tape. We sell by the foot, so just make sure you measure it and know how long it is so we can charge them the correct amount. And you always want to cut it a little bit longer than necessary, because when you tie it, it will get shorter. So the easiest way to cut it is to put it on stretch. It just makes it a little bit easier. So you can have someone else hold it tight while you cut it. If you're in a hurry, you can kind of scrunch it and cut it, and that will make it. And then when we tie it, there's two different ways you can tie the T-bands. If they're using it for their arms, you'll just tie both ends, looping around like this. And then you just want to pull it tight, and you do that on both sides. If they want a looped band, you'll just put both of them together like this and tie it off the same way and pull it tight. And with the tubing, usually we'll cut off a section, we'll tie off both ends, we'll make the little hand loops for them. And the same thing, you just tie it in a loop like this. And you want to pull it as tight as you can. And you'll do both ends and then give it to the patient.
If a
keep
patient
going.
needs any equipment, we'll make sure to notice the length that you sell it by, and oh my gosh, I don't know